the Dr. Deborah Show. And this is the show where we talk about bringing peace and calm into your life. And later in the show, we'll be talking about mental health stigma. And we're live at KCSB FM Santa Barbara 91.9. And KCSB is a platform for cultural expression and thoughtful discussion, providing a diverse educational forum. And I'm a Santa Barbara-based clinical psychologist, and I specialize in pediatric neuropsychology. And during my clinical training and my current work, I've treated thousands of people, and I want to share my experiences with you. I'm also a UCSB alumni, and I live locally in Santa Barbara. And this show is all about our community and how to create compassionate conversations about our well-being and health. And before we get started, I just wanted to talk just for a moment on the reflection of the New Zealand tragedy, because I think that does relate to our mental health. I think even though it's across the world, we're still impacted by that. So I just kind of wanted to talk just for a minute and just honor that, if you aren't aware, that there was a violent attack on the Muslim community in New Zealand that took the lives of 49 people and also left dozens injured. And at UCSB, there was actually a really beautiful gathering at Stork Tower, as well as there was also a gathering in Santa Barbara at the Sunken Gardens to stand in solidarity with the Muslims of New Zealand and also with our own community against hate. And so it's a great opportunity to show our support not only for the victims and loved ones that are affected by the tragic shootings in Christchurch, but also for those on our own campus and community. So I just wanted to express my caring and concern and support, and also to remind you that there are resources for students. If you do need psychological help, you can contact CAPS. It's 805-893-4411. There's also a number for students in distress. It's called, the phone number is 805-893-3030. And so I just wanted to just kind of acknowledge those and reach out to those who are grieving or feeling unsafe, and to show them that they're not alone. And I think in our community, we do care deeply for one another, and every one of our students and community members matters, and our strength as a community comes from our collective support of one another. So I just wanted to say that. And today on the show, we are going to be talking about mental health and well-being with a focus on politics, but with legislation advocacy, with our very special guest, Doss Williams. And Doss was elected to represent the 1st District of Santa Barbara County in June 2016. And Williams previously represented the area along with over half of Santa Barbara County and a quarter of Ventura County in the California State Assembly from 2010 to 2016. And prior to Doss's service in the Assembly, he served 7 years on the Santa Barbara City Council from 2003 to 2010, and he also served as a trustee for Peabody Charter School, which is actually where my son goes, so I was excited when I read that. During his extensive public service, Williams also has earned a reputation as a champion for renewable energy and the reduction of greenhouse gas emissions. In the Assembly, Williams helped successfully advocate for requirements that 33% of the state's energy come from renewable sources by 2020, which is really awesome. And with the state on track to hit that goal, Williams has authored legislation to increase the renewable energy bill to 50% by 2030. Good job. A lifelong advocate for our coast, Doss Williams has championed requiring testing of groundwater before, during, and after hydraulic fracturing, which was included in California's regulations on fracking, and authored legislation to expand groundwater monitoring to other types of injection wells to protect underground sources of drinking water from oil and gas wastewater disposal. Doss Williams also has taken leadership to ensure statewide resources would be spent locally to provide relief from the drought, including securing funds for the Lake Cachuma Pump Project and supporting funding for water recycling and conservation efforts. He's been a leader on the community preparedness level. He's hosted an emergency preparedness fair every year since he took office, and working to ensure that 9/11 calls are correctly routed to cut down on response time. And Doss Williams actually grew up in Santa Barbara County, and he attended local schools. And he, in addition to his service as an elected office, he's taught at Antioch University in Santa Barbara. He's worked as a junior high school teacher, as well as legislative aide to California State Assembly member Hannah Beth Jackson. And also, Williams holds a master's degree in environmental science and management from UCSB with a focus on water pollution, planning processes, and land use law. And that's from UCSB's Bren School of Environmental Science. So welcome to the show, Doss.
Thank you so much for having me, and thank you for the reminder. I'm going to have to trim down that bio.
There are a lot of great things you've done, though.
Thank you.
I tried to actually trim that down, but there was just too many good things in there. I couldn't take them out.
Well, it's great to be back here in the KCSB studio. I used to have a punk radio show when I was in high school here, and I got to tell you, the studio actually hasn't changed very much. I'm sure there's some more MP3 technologies here, but it really hasn't changed that much.
Which is good, though.
We Santa Barbarans are attached to tradition.
We are.
But it's great to be here because the counties in the state of California are the entity that implements both local and statewide work on mental health. So we essentially implement the safety net. The state may dictate what the safety net is, but it's up to counties to implement the safety net. And so it's a pleasure to be here to talk about the challenges of mental health.
I'm so glad you're here. And I mean, it's really important for us to have leaders like Doss, because what I love about you, and I kind of have known you intermittently in different ways, but I just love that you're so committed to our community, and you get educated, and you're out doing so many things, that are really proactive, that are making a big difference, like immediately. So thank you for all your hard work. I really appreciate it.
Thank you.
And I mean, we are talking about mental health, but I think it does intersect with any profession. That's why I have different people come in. And so I am so excited to have Doss here to talk about mental health and politics, and how legislation, advocacy affect or intersect with mental health. And I'm talking about mental health stigma today because mental health is the largest public health priority and the largest financial burden, supposedly, of any health issue in the world. That's according to the World Health Organization and the World Economic Forum. And in a report from the Centers for Disease Control, it's a big report I talk about each time, it's called Attitudes Toward Mental Illness. They found that stigma and embarrassment are two of the top reasons why people with mental health issues don't seek help or medication. And I also just like to always clarify that issues surrounding mental health really affect everyone from all walks of life. None of us are immune to or can, not have mental health issues, but I think some of us have more things going on. And I'd just like to talk a little bit about what is mental health. I was wondering, Doss, maybe if you wanted to describe what you think mental health is.
Well, I think it's really important when we talk about mental health to not talk about it as the other. We are not talking about the other. The most important research on the subject indicates that it's not a kind of binary thing where people either have mental health issues or they don't. That's the way that people used to think about this.
Right.
But researchers at this point more put it as a continuum. That pretty much it's a continuum we're all on, and most people are not ones and sevens. That's the continuum, meaning the people with the least mental health issues or the most. Yep. Most human beings were somewhere in the middle. We have moments of crisis. We have some of us have long-term issues, but and the kind of care that we seek can affect where on the continuum of mental health issues we are at.
Very true.
And that's really also intersects with the real public policy issue with mental health, because our mental health system is expensive and it is not good at addressing prevention, but there are real reasons why that's the case. It's not just a question of sort of political courage. Mm-hmm. I would actually indicate that the reason why so much more money gets spent at the highly acute
Level of care.
end of mental health care
Yeah.
is because that's generally what well-meaning people lobby the government to do, right? And in some cases, they do more than lobby the government. Some well-meaning groups, for instance, have sued the county over the practices at the jail, right?
Right,
or
right.
are threatening, not suing, threatening.
Right.
And so well-meaning people push institutions, both the county, the state, and local hospitals, to spend money at the most acute end of the scale.
Yep.
And while in some cases that may be needed, those are the same dollars that would go towards creating facilities at the preventative level. And
Sure.
this is the essential public policy quandary in mental
Right.
health care. How do you spend money on prevention
Yep.
when everybody's asking us to spend money on triage?
Although, I mean, I love what you're bringing up. That's such a valid point. I worked at the county mental health from 2004 and 2005. I worked for the MAT team, which is like when people get taken against their own will. So I'm certified to 5150, which is when you get taken against your own will. And we'd have these meetings, and when I was there, I would literally spend all day with a family on the phone. I would get in trouble because I didn't want them to get hospitalized, because I knew it was kind of like a revolving door. And it's some people, it's very traumatic to go to the hospital. And when we would do our budgetary meetings, I would always say, wow, it was like, we're so far over and we're only 6 months into the year. Why don't we build some kind of other interim care, like partial hospitalization but I am very into prevention, and that's why I like to do this show, because I hear what you're saying though. So you're saying we're in a quandary in a way, because what people are advocating for, like through legislation, is they want to have the more severe people taken care of. But really what at the heart of it is really we need more prevention. So how
That's
do we
right.
get both ends of that?
I think we've definitely moved towards wanting to do more things like step-down facilities, more preventative work. But a part of definitely the issue is the emphasis gets placed on. For instance, most people know that we need more facilities in town, but they think first of having a second, say, psychiatric health facility. And while we need probably more beds than the number we have right now, we may not need that as much as we need, for instance, IMD beds. Those are long-term placements for people, conserved individuals, or step-down facilities to get people at a lower level of care once they've stabilized in the psych unit. And might be able to live a more normal life, and so really what we need to do is make that investment in what people call the continuum of care, but the cost drivers on mental health right now are so difficult, and that it becomes very hard to make those investments. I'll give you an example.
Okay.
We've had such a rise in the last 6 years, we had over a 200% rise in the number of conserved individuals
Interesting.
in this county.
Wow.
And so that means, and there's very few facilities in the state, and they're charging more because that's just happened all over the state.
Right.
So the costs go way up. That's, I should say, a 200% rise in the cost of conserving individuals.
Because it's expensive.
Because we
I
have more
remember
people.
it was like $100,000, isn't it, for the county to conserve someone?
It is expensive,
Yeah.
and we don't have any facilities here in the county. We don't have any public facilities where we aren't at the mercy of the market for paying whatever people can charge us.
Right.
So one of the goals that I definitely have is for us to have some IMD beds that the county either has itself or is contracted in the county in a way that is sustainable cost-wise.
Yeah.
And of course, part of this is that there's really two entities that have sort of overlapping responsibility for this population, which is the county and the private hospitals in the county. And
Yeah.
I would probably say we are at the tail end of a 20-year blame game.
Right. That's what's going on.
Between those entities, and my hope is our current negotiations with the hospitals will yield more facilities. I right now see more political will, both from the county and from local private hospitals, which includes Cottage and Marion and Lompoc Hospital, to try to find solutions that work for both entities.
What do you think of the idea? It just kind of came to me of, and actually it's been an ongoing woven discussion with other people in a way, but of having more of just primary care, people who are on the front lines that see every, because if you pick somewhere in the middle between those two extremes that you were talking about, hospitalization or just, I guess, not getting treatment, would be, something maybe where the frontline people have more training in mental health or maybe have mental health professionals in their office or something. I just feel like there's like a gap that way too. I don't know. There's just
that is definitely the thinking behind the changes that took place in the Affordable Care Act.
Right.
Obama's Affordable Care Act sort of mandates that integration of mental health care into what professionals in medical care are calling the medical home model, right? Of one place where somebody goes. And it gets at the quandary that you were dealing with when you worked for the county, it sounds like, where it might be helpful and save the county money in the long run by spending more time with a client, but you're only reimbursed by the state for a certain amount of time.
Right.
And so your supervisors are going, how come you aren't seeing more clients?
Well, because I used to do 900 evaluations a month, and there was only like 5 of us. So and that was for the whole county. But I have a feeling that number's probably gone up.
Right.
And that was only one of my jobs.
If you're driven by reimbursement, one of the best places to provide mental health services would be where people who qualify for reimbursement are all the time, which is in our public health clinics.
Right.
Which happens to be a different department in the county, but at least it's both operated by the county. So what we are doing is integrating some mental health professionals into our public health clinics.
Right.
Where they are already seeing Medi-Cal clients. Because of Medi-Cal expansion, there's even more of them coming in.
Right, that's what I saw, is that people are actually converting from their insurance to Medi-Cal because they know they'll get better mental health care. I thought that was interesting.
That's right. And so, and we have a good network of Medi-Cal facilities in Santa Barbara County, some operated by the county, like the Carpinteria, and some operated by other entities like American Indian Health and Service down at the State in 154, and the neighborhood clinic system exemplified by the facility on Milpas.
Right.
So we have great facilities in this county that see and do primary care for Medi-Cal, individuals on Medi-Cal. And so what we've tried to do at the county is starting to make sure that they have the opportunity to also see a mental health professional. Carpinteria wasn't originally going to be one of the first of our health clinics that has that. That was something that was a real priority for me. We now are going to have Carpinteria in that mix. And part of that is going to be the opening of what people are calling Carpinteria Connect, which is essentially, a mix facility that, number one, will be where public health's mental health professional can see folks, but also where during the other hours, it's sort of a drop-in center where community groups and the county can both provide some services.
And Doss and I kind of collaborate in a way because one of the reasons I do the show is I'm on the board, as I talk about usually the end of my show, but that I'm on the board of HopeNet of Carpinteria, which HopeNet of Carpinteria is a group of citizens in Carpinteria. I happen to be there. I don't live in Carpinteria, but my husband has worked in Carpinteria, and I've been going to Carpinteria since I was a kid. And Carpentry is really working hard to try to provide resources and expand and set up maybe an infrastructure that other communities could also follow. And so there's this great resource called CARP Connect, which provides individuals and families with mental health services from local partnering agencies. And it's in an effort to enhance and expand access to behavioral health services. It's actually going to be on the ground floor of the Carpentry of Veterans building. And the ribbon cutting for that is actually April 5th at 11 a.m. and the event's open to the public if anybody's interested in coming. But also it's a great way if you want to get plugged into resources and you happen to live in Carpinteria. And their phone number is 805-560-1050. So I think, there's some bubbling up, it seems like, of resources, maybe more for people. But also it's like, I think, how do people get to the resources? Which brings me back to my definitions I like to just give about mental health stigma. Because I think some people don't really even know, we hear the word stigma and it kind of is a funny word. But I like to just educate people a little bit that, I think one of the big issues that we're facing is the idea of how do we just talk about mental health? Because I think for so long, people feel like mental health is something we shouldn't talk about. Like it's like, the other people. And so I broke it down into two kind of categories, which is social stigma and self-stigma. And social stigma is when attitudes and discriminating behavior are directed toward individuals with mental health problems as a result of the label they may have been given. So that's like when society kind of comes at the person and they feel stigmatized that way. And then self-stigma, which is very common, is when the person internalizes the perception of discrimination. Like if maybe somebody's never been depressed and they've always thought depressed people were weird or whatever, and then they become depressed and they're like, oh my gosh, I'm weird now. But there's nothing weird about being depressed because everybody gets depressed and anxious. So just so you know that, but also just to think about stigma and how it affects the ability to get resources, because I think there's so much shame around the word mental health. But I do think, it's so important for us to talk about this and take care of our mental health by being able to discuss our emotions, thoughts, and feelings that are within ourselves. And you did a great job describing mental health, so I'm not going to even add to that. I was curious, how do you think mental health and politics, like legislation, advocacy, intersect? I know you're talking about all the actions that are happening. And even for politicians, about how a politician takes care of themselves, right? Like, I know you pride yourself on that too. In that regard, it could be any way. I was just curious how do you think mental health and politics intersect?
Well, I think that in terms of they intersect at the policy level of just the question of how can we make sure that people get good mental health care at a amount of money that is affordable to the taxpayer,
right.
And that's a really tough quandary. I'll give you one example that's debated a lot in the legislature right now, which is there's every year, the last couple of years, there's been a lot of bills to expand the number of people that could issue 5150s.
Right. It's very limited amount of people.
So right now, you pretty much got to be a professional, and you got to, as a professional, you can explain it better than me. But as I understand it, the danger has to be imminent, and it has to be identifiable.
But there's also a whole series of I know it's gotten a little bit more broader, but when I got certified, I just remember, for example, with alcoholism, someone was weren't saying they were suicidal, but they're obviously killing themselves with alcohol. We really couldn't take somebody. I think that's changed now. But so 5150, in case you don't know, is when you get taken against your own will, because like Doss is saying, you are imminent, meaning you have a plan to hurt yourself or somebody else that is very detailed. And it's not like I'm just thinking about it. It's and so there's plan, intention, and ideation. So plan is, do you have a plan? I'm going to drive off the 154 at 6:00 on Tuesday. Intention would be how strongly you feel you're going to follow through with that. And ideation is how often you think about that. So is it every day? Is it every minute? Is it once a week? Is it once a year? And, a lot of factors come into place with that. And then, so a 5150 is where someone gets taken and they're put on a hold and they're evaluated. But there's a lot of, issues around that because I think, people feel that their rights get taken away, and actually I know I have met people, like, I don't have too many patients in my practice now, but I have had several years ago, like, I went and met a patient. I will go meet my patients if they're at Cottage Hospital, or I will talk to the police, like if they call me, and try to negotiate that. But I think some people enjoy going to the hospital because they feel safer, and some people really don't like it. So it's a very personal choice. But I kind of also think that if we could get to the person way sooner, I guess I'm just saying
Yes.
the prevention.
I think that's obviously the
key.
crucial.
Yeah.
But and this is the interesting thing is that so a lot of of my former colleagues in the legislature who are very well intentioned on mental health are authoring bills that say expand the number of people that could do 5150s or expand the criteria for a 5150. So, for instance, the proposal before has been to allow law enforcement. They right now they can at the discretion of the county. That
was how it was when I was there. Yeah.
Now they could mandate that all counties would have to allow law enforcement to do it or expand it some other way.
They've done that before. When I was on the MAT team, that's exactly actually what would happen is we didn't have enough people to go on the field. That's how limited the clinicians are, and I would be on call. I'd leave work at 5. I'd work 8 to 5. They give me a phone. I'd leave, and I was on call all night long, and I go back to work the next day. And from the time, whenever someone called, it was, a fireman, policeman, because they go out to clear the scene. And then a paramedic would arrive. And then those days, the paramedics were trained as mental. And then I would debrief and go and do an assessment over the phone with the paramedics and the police. So it was a little interesting. And then, if I had to find a bed, then I would be spending an hour or so going up and down the coast. In those days, we used to take people by ambulance. I don't think they do that anymore, right? Because that's very expensive, too.
Yeah, God, I hope not.
I know the partial, like when I worked at NAMI and stuff, because I was the family advocate at, the mental wellness center, and people would talk a lot about partial hospitalization, but because I guess it's somewhere in the middle, and maybe it's not as expensive, because the person goes home at the end of the day.
Right.
So, yeah, it is. It's kind of, I hear what you're saying. It's a bit of a quandary.
It is. And if we vastly expand the amount of people who can issue, we will vastly expand the number of 5150s. And do we have the beds? Do we have the infrastructure for it? No. And again, we get at this situation where very well-meaning people create a situation where counties have even less money to spend on prevention because we're trying to open up more beds in the psych.
Is that what's going on in Santa Barbara? Or?
Well, I think that's the danger if the number of people or the professions of people that could issue 5150s or the criteria gets widened enough for a lot more people to be 5150. Not to mention the issue that you brought up of, is it really desirable for people with mental health issues to be taken against their will? Yeah. And that's a sticky question. I don't really have easy answers for that. But I do know the fiscal reality is we can't handle that.
I actually think that's good feedback because I kind of believe in there's signs we get. But for me, I personally, what I meant to actually say earlier was that when I would spend all afternoon or whatever with a person, my colleagues might hospitalize 5 people in the week. I hospitalized 2 people in a whole year because I knew it would save the county money. And the families, they were so appreciative. They really, because they didn't know what to do. They don't know how to navigate through the system. It's confusing. They don't know where to go for resources. So I would just open up my book and just start calling for them, and they're so under so much duress or pressure from, the concern of a loved one.
Right.
So I definitely wanted to respond to their need. But then, of course, like you're saying, my other jobs, I used to authorize all the community-based organizations. I used to do all the primary care referrals from public health. I did 9 jobs. So, of course, if one goes, but I would just work more because I knew it would pay off for that family or that person, in the long run. But I don't know. It sounds like that's maybe not feasible in a way.
We need more people to, be able and willing to do that. I mean, it is. That's the challenge is how to do more prevention when we're having to throw a ton of money at the triage, and it is. But I mean, the good news is that our understanding of the issues are getting better.
That's true. That's true.
I think particularly in the realm of adverse childhood experiences and the health ramifications of it. That is a truly important innovation, I think, to allow people to screen and to understand that there are real physical health consequences to traumatic experiences for our kids.
And we live, I'm really excited because California, I mean, we have like the first Surgeon General, or Nadine Burke-Harris, who is kind of the trauma. She's a pediatrician in, I think, Oakland. And her topic of interest is childhood trauma and the adverse, what's it called? The ACEs?
The ACEs test, the adverse childhood experience.
And so that's a hot word. You'll probably hear ACEs because people are trying to do more screenings. And that's what I did all my research on. And I think it's so wonderful. Makes my heart really happy because I think we don't realize pathology. Pathology is like, you have cancer or something. You go to the lab, they check out, whatever they've taken out, a biopsy. Mental health is very similar. We look for the pathology. Where did it start? And, the first 2 years of life, 50% of your personality gets developed. And the third year, another 25%. So by the time you're 75% doesn't mean you can't change your personality. But, if you combine that with different factors of trauma, you can actually really trace that back very easily. But I think we've overlooked that. We're not overlooking it now. And actually, I was excited because I did see that. I know that in the past, it was saying in the news that in the past 2 decades since California enacted a law requiring health plans to provide coverage for the diagnosis and treatment of severe mental health. And then in 2008, it was talking about parity became federal law. And I guess that they're saying that it's complicated to ascertain whether any given person struggles to get appropriate mental health care reflect parity violations. So a parity is like when someone has a very severe mental health diagnosis, like schizophrenia, although eating disorders are in the same category. So when you bill that for insurance, that's what the insurance companies, they want a parity. But, people need other mental health treatment. And so that Affordable Care Act, I think is that what you were talking about too, is an essential health benefit. I guess do you think that that's working well or?
Well, I think it has to be an essential health benefit. I mean, for full disclosure, I was a member of the healthcare committee in my first 2 years in the state legislature. And I think the biggest decision that we ever made during those 2 years was determining the state of California's list of the essential health benefits.
Nice.
And so we debated this and decided that we very much would put mental health as one of the essential health benefits. Obviously, the more things you put as an essential health benefit, the more expensive insurance will be. But if you don't cover things that are basic needs that most people need, like I hate to say this, guys, pregnancy has to be on the list of an essential health benefit because 51% of society is eligible to have that happen to them at least once in their lifetime. And so, things like that, we do not want to have a situation where any insurer is tempted by financial incentives to not cover anybody with a history of mental health care, because what that does is it perpetuates the stigma, right? Anything that we have that encourages people to remain in the shadows and not get proper care is not good for our healthcare system.
That was you just answered my question. I was reading. It was like, how do you think legislation advocacy accepts or rejects mental health stigma? So there was the answer there.
Is we want to promote the open door. And I do think the good news is that there is less societal stigma. I'm hoping that translates into less personal, internalized stigma over time. I can tell you, since a lot of your listeners are student listeners at KCSB, I know many of the mental health care professionals, UCSB. I think that professionally they offer a great product, and so I would, if I were you, I would go with real confidence in seeking any level of care at the Hospital Clinic, at CAPS,
mental health, the health center.
I mean, while you are a student, you have enormous opportunities for good care that you don't always have later on because of our privatized health insurance system.
Although it's good for the students to know, because then when they get out, right, I mean, it is important to maximize, like Doss is saying, take advantage of what resources you have. It is a great, I used to go to student health a lot, and I forgot my first pair of glasses, and actually I work with a psychiatrist there. They're super fabulous. So I love Dr. Dawes. She's amazing. And and they're nice people. I think they really do have a heart for what they're doing, and they cover every possible mental health condition. I know that, in Santa Barbara, we're working hard to talk about mental health and to create more advocacy. I was curious, what has your work in like the legislation advocacy field taught you about the attitudes held, like when you go out, and deal with other politicians and people? What has that taught you, or just in your meetings what are the attitudes held toward mental health? Spit that out there.
Well, I think I think intentions are still very good on this. I think we still have the challenge that our whole system of taxation and government is sort of a system that when the fiscal picture isn't doing so well, there is just too little money in the system to handle both the higher education needs, the law enforcement needs, and the mental health needs of the people of the state of California. Now, right now, there might be barely enough because it's been a long time since we had a recession. But as soon as a recession happens, we will have insufficient amount of money to do those needs. And, to give you an idea, the two biggest departments in the county are our sheriff's department. Yep. And the biggest part of that is the jail. And the other big department is behavioral wellness, our mental health system. So it really is no accident that those are our two places. If we get it wrong in mental health, then unfortunately we pay for it even more in law enforcement.
Although it was interesting. I saw this pie chart of law enforcement. How many people die? What people die from that work in law enforcement? I was just a couple weeks ago. It was like I was looking up something, and it said 44% of people in law enforcement commit suicide. That's the biggest chunk of people, actually, that, that's how I would have thought they lost their lives in the line of, duty, like being shot or something. So I think, wow, that would be like a sign to me, like we need to take care of our law enforcement. This is a worthy investment for us. It's not like we're going to put money into something that's not going somewhere. I noticed I think that's a real issue that should be highlighted. I can tell you from personal experience with our first responders, both in the sheriff's department and in the county fire and in Montecito Fire, that the work they did in Thomas Fire and the 1-9 debris flow was vital, but a lot of that darkness gets internalized by our first responders, and it is not without consequence. That heroism is not without consequence and a price that they pay. Right. I was a first responder. I mean, I didn't go out like pulling people out of mud, but I did write you, and then I somehow got connected up, and so I was at funerals and cemeteries, and I gave so much of my heart myself. I mean, I'm still recovering from giving so much, because I think everybody got PTSD too. But I mean, that's why it's so important to talk about, because I mean, if you don't become conscious or aware of what your trauma is, it doesn't go away, and I've actually copyrighted, I call it the compounding theory of stress. And it kind of relates to trauma too. It's like putting money in the bank, and you have something, you kind of think, oh, it's not a very big deal, and then another thing happens, and it is like a snowball effect a little bit too. But what I call the kicker happens, and your nervous system really can only tolerate, your heart and your brain, everything, it can only tolerate just so much stress. So I mean, at some point, those people will need, I think, treatment. But it's just, I think we can all bond together is, I guess, what I'm really saying. And
there's a great, for those of you, if anybody is listening, that it's in the law enforcement field, there's a great non-professional who does a great work on this, retired Santa Barbara PD Sergeant Mike McGrew,
nice.
Who when the first years, the years that I first knew him, he's about the toughest guy you ever met. And since then, he, because of a path of great pain in his own life, he also became a pastor.
Nice.
And so what he has done is to embark on a lot of care for law enforcement and fire professionals post event. So, if you ever want to get connected with Mike
McGrew, I wrote his name down.
He's a great guy. You may want to have him on this.
I'd love
this
to.
show.
I actually have had Sherilyn Lee. Dr. Lee came on, who's their new behavioral. They have a whole behavioral unit at the sheriff's department.
That's right.
So I think the sheriffs are trying, to have more mental health. I saw this little news. I always just like to put little news clips in here about Santa Barbara. And I guess that because of rising suicide rates and mental health problems among the state's youth, there's a bill in the California Senate that would require all new teachers to have mental health first aid training. And I just thought that was an interesting idea, that basically it would teach the participants how to recognize the signs of mental distress and substance use disorders, and be able to refer students to resources. Teachers have become so, it's like they have so many roles they wear, but they're saying it's kind of like a type of CPR because, suicide is like the second leading cause of death among teenagers. So, I mean, I think this is, it's an up and come. It's not just, it doesn't cover one age group either. Like when I look at all the mental health statistics in Santa Barbara County, it covers every age group.
Right.
What do you think about having, how do you feel a person who understands like legislation, advocacy, and what we're talking about, from all these different angles could help a person navigate through a mental health crisis?
Well, I think the malaise of our age is the superficiality of our interconnectedness, and that, the institutions and the that we used to that people in society used to be a deeper part of, whether that's their, Elks Lodge, or that's their church,
Masonic temple,
or that's their, chapter of the NAACP, or whether that's your, local sports group. People used to have a deeper interconnectedness, right? Now we seemingly interact with more people, but at a more superficial level. And what I question is whether that's really great for our emotional well-being.
I don't think that's good for our well-being.
Yeah, to me, a deep connection, a quality over quantity in the relationships that people seek to have is really important. And, and that's, so I think that, frankly, even though I am a big advocate of the work that a trained mental health professional can do, given the fact that my wife is a psychologist. I also advocate for the kind of care that folks, whether they're a pastor, a priest, or a school counselor, can provide.
I mean, I actually think I try to teach all my patients. I've only had one patient get mad at me, but to be like mini psychologists. And they come back after they've come in for a long time, and then they're helping other people. And it gives them a sense of pride. And I always try to teach them about taking care of themselves when they're giving too. But I think what you're saying is true. I think we all inherently, I had a guest, Rodalee Weininger, I don't know if you know her, but she's a physician and a psychologist in town, and we were talking about how we all need to feel like we're part of a tribe. I mean, there's kind of like the global tribe, and there's our community tribes, there's our family tribes, but we need to feel connected. And I actually did my PhD. I have an emphasis in depth psychology, which I think you were talking about more depth in our relationships, and I think we have lost that. But it's naturally happened because we're not looking at each other. We're not talking to each other as much. We're not, they did a study in the 70s in some little town in the Midwest that had never had TV. It's a really cool little simple study, but they basically just went and observed this little town and what the people were doing. And they were playing bingo. They were hanging on each other's porches, having lemonade. They do dances. You know, the stuff you're talking about, going to the Elks Lodge, going to your favorite sporting event, those things. When they brought in TV, that slowly dissipated. That slowly stopped, and people just didn't do that. And I think that now it's so extreme, and I'm kind of a cowgirl. I grew up in San Luis Obispo, but it's like I inherently like the grass and the mountains and the horses and all that because that's how I grew up. But I think if we don't have a foundation of, like how to operate from, then we just go with the flow of, okay, this is what's on the news. This is what's on the TV.
Yeah, this is all the emails that I'm being bombarded with. This is all the Facebook updates I'm getting bombarded with. And that's how I'm going to, interact with society. That's my point is that that's not enough. And, I think she's right. This professional that you,
Dr. Weininger,
there's been really good research done on it as part of the explanation of the attractiveness of gang membership and of the rise of Islamic terrorist groups. That it has a lot more to do with certain people in society that feel adrift, needing a tribe. And if the bad guys offer a better tribe than the good guys or good gals, then we got a problem. So that I think is a real important issue for us to grapple with. I think the other intersection really with that we haven't touched on today yet is substance abuse. The rise of suicides has at least been correlated a lot with a portion thereof of the rise of opiate abuse, which exploded largely from legal avenues, legal, but I would add underhanded avenues. So one other public policy tool is that that we always have is our ability to sue folks who did wrong, and the county is participating among other county governments in a lawsuit against the opiate manufacturers and distributors.
There's a great expose on 60 Minutes on if people are interested in just learning about the history of the opiate epidemic and the companies and all of that. And I actually, even just last week, I'm a Medicare provider. I got a letter, and I thought, it's a letter about something billing related. But it actually was a 3-page letter from them, and it was all about the opioid epidemic and how to look for people and to deal with that. It's a big problem. And so, I think that's going to be a major issue we're going to have to confront. And unfortunately, I think when we take pills and other things, if we don't really understand the intersections that way or how, the long-term effects, and somebody gives it to us because, we trust them. But it is a big problem. So you're saying that this community, this county...
It's a huge... I just think it's a huge driver exacerbating our mental health issues. And if you look at, I think if you look at the cases of kids that are most acute, the cases of kids also entering the foster care system, which have, obviously, or kids with high ACEs scores, the driver, when you get down to it, is the drug or alcohol abuse of their parents.
Right. Well, that's why as a parent, it's so important to think about what choices you're making and how that impacts your children. And also, if you do have pills you take, make sure not to leave them around your house because kids might think those are, candies or something.
Or they'll consciously use them if they're a little bit older. And so, it's a good reminder to let you know that since most of your listeners probably have some outdated medication of some kind or other, whether it's medical or mental health. There is the right and the wrong way to dispose of that. The wrong way is to leave it in your cabinet for 10 years or to flush it down the toilet. Those are the two wrong ways. The right way is to bring it to either any police department, sheriff's department, or if you prefer to be totally anonymous, there's a little mailbox over by the East Side Library and in a couple other places around town.
Well, yeah, I always try to educate people because I think they take pills and things and they also don't realize interactions with alcohol. And I find that that's a big problem because people think, I'm going to take this pill, it's going to make me feel better, it's going to help me with my anxiety, and then they go out and have a drink. And, even the pharmacists I know, they will really look that stuff up. So, you're not a pharmacist. You have to be honest with yourself about who you are and where those came from, like Doss is saying. But I just think that, it's important to really, take a look at yourself, too. It's like we're all here together, and we're all here with ourselves. I believe, too, in the kind of collective unconscious. So I kind of think, if that's how I was trained, it's called the anima mundi, is more, there's a collective conscious for our world. And I feel like we are at a really crucial crossroads. It's an opportunity for us to actually really reevaluate, what's important to us, and what we really need to have a happy or healthy life. I don't think we can always have happiness, but some level of satisfaction and peace. And I do think having, these discussions about mental health are so important because mental health stigma really creates a wall that stops the compassion and the conversation. So having these compassionate conversations really builds inclusiveness and then teaches others what you've learned, even like with Doss or whoever, comes in. It's so great because it leads to this understanding and including and caring. And I'm always trying to imagine a world where we can share our feelings and thoughts more freely and where we can move toward health for all human beings. So, you can go out, even whether you're a student or adult or whatever age you are. I think, you can go out and volunteer. You can check in with yourself. You can learn about other cultures. And also make sure to get accurate information from accurate, reliable sources. And do you have any other recommendations, Doss, about how people can get involved or how we could put more legislation and advocacy into our lives that would help to create more mental health?
Well, I just would say that shifting the emphasis towards prevention is a really thing that more elected officials will do if more people ask for it. But to understand that means less emphasis on the acute end, right. And that's a little bit of a tough situation, right? It either means less emphasis on the acute end or it means the necessity for a lot more revenue into the system.
Right.
One or the other.
I think we need more revenue.
And then the other thing I would give is just more advice on a personal level. I think, one of the things that you asked that I can, thus far conspicuously avoided was what is the mental health issues that people in politics deal with? And, it's kind of, I think in a way it's kind of interesting that our democracy puts into the hands of people who are extremely overworked, all type A personalities that run around and elected officials, the way our lifestyle is inherently bad for their own mental health, and you put us in charge of mental health policy,
right?
So it is a great irony, and so my only advice to people out there is, regardless of the adverse childhood experiences you may have, regardless of where you are at right now, what you are struggling with, to me the biggest thing is about that there is hope of being in a different place.
Yeah.
If the ingredients in your life are different, whether those are, less substances or different people in your life or a little bit of help that you're getting from the right folks, things can look very different. I mean, for me, even though I got a lot of good service done for the community, I can, in retrospect, say that I was not a very happy person for most of my life, right?
Yeah.
But then the right things and ingredients happen in my life, including finding my wife in life, and my whole life turned around in the long run. And so, I think that as long as people put out hope and try to change maybe some of the ingredients that are in their life to get to another place, that's the really important thing. That if you are out there and in crisis, or your life has perpetual darkness in it, then get some help and change the ingredients in your life.
It's such a good recommendation. I know I always tell people, they say, I got to change. I'll change tomorrow or next. I just say, just take it minute by minute, day by day, hour by hour. There's no rush. And I think, Margaret Mead, the cultural anthropologist, sums up in a way what you're talking about too, is like, be novel.